Good afternoon. I'm pleased to be here with Dr. Williams, Ontario's Chief Medical Officer of Health. Since we first started planning for the reopening of schools across the province, the Premier and I committed to you that our plan would be responsive and adaptive to the evolving advice and guidance of medical and pediatric experts in this country. This is not only the most responsible approach in the midst of an uncertain global pandemic, it's also the approach that will allow us to consistently build upon our actions to protect the health and safety of the 2 million students in this province. It is by listening to those health professionals that has foundationally enabled us as a province to be where we're at today. Just this morning, the province reported 78 COVID-19 cases. Folks, we are clearly on the right path, and we should be proud of the progress we've made as a society and as a province. But I know that many parents are wondering what the return to school will mean for their child who will be entering a classroom for the first time since the pandemic came into our lives. Let me be perfectly clear. If the best medical advice in the province did not think it was safe for your child to go back to school, the choice would have been simple. Fortunately, through robust consultation with medical experts inside and outside of government, and due to the outstanding sacrifices of all Ontarians, over the past several months we're in a position where we are able to safely and confidently reopen schools, but with strict health and safety protocols to protect us all. To date, we are investing $60 million in PPE for all students and staff, supported by the most comprehensive masking protocol in Canada that mandates masks for all staff and for students in grade 4 and up, and encourages them for those younger. We are funding mandatory health and safety training of all teachers to make sure that their classroom and interactions with students always maximize safety. Moreover, we're investing over $100 million for custodians and enhanced cleaning supplies for schools and for buses, meaning that high-touch surfaces and school facilities will be regularly cleaned. Ontario uniquely has a plan for aggressive surveillance testing of our students, and we stand alone as the only province in this country to have planned to hire 500 public health nurses into our school system to assist with surveillance testing, with symptom monitoring, and making sure the staff and students have the knowledge and the tools they need to stay safe. These investments, totaling over $300 million, position Ontario as the leading jurisdiction in per pupil funding for COVID-related supports and resources. No province has invested more in the safety of our students than ours, and we're proud of that. Folks, we're leading the nation, and indeed many jurisdictions in the world, on our layers of prevention approach to reopen schools safely, and we're backing that up with unprecedented investment. Like we said, our plan is a living document. It is responding to the needs on the ground with a singular focus on safety. Today, I'm proud to unveil the next steps of our strategy to safely return to class and build upon the layers of prevention we've already announced. Effective immediately, I'm directing that boards will be able to invest nearly $500 million in funding to support local priorities with a focus on greater social distancing in class. While many boards are already looking at utilizing out-of-school community spaces, this funding will also support them further to do that if it is required. To do this, I'll be expanding the ability of boards for this year only in a one-time request to access reserve funding, which is taxpayer dollars that are unspent, which can immediately be used for these priorities with a focus on greater social distancing. In addition to that $500 million investment, medical experts have emphasized the importance of improved airflow and quality. Now, currently in the province, we dedicate about $1.4 billion for school maintenance funding, which supports things like HVAC upgrades or water fountain renewals or washroom upgrades, things like that. However, we will go further. We will build upon this existing investment. Our government will be providing $50 million in new and direct one-time support for immediate ventilation and other HVAC upgrades to improve air quality in classrooms in this province. This will give peace of mind that the air our children are breathing is safe and that these upgrades can commence immediately. Finally, while we are dramatically and systematically improving the safety of schools, our children believe parents deserve a choice. Most, if not all, provinces in this country do not have a remote learning option for parents. Ontario does, and I want it to be strong, consistent, and quality for our children. The message was clear from parents that they want their children to have access to their teacher for the entire day and supported by live synchronous learning or Zoom-style classrooms. They want a greater focus on supports, accountability, and expectations and resources for their child. And we certainly agree. And while we have faced strong opposition to date from unions in this respect, we do know that students deserve what is best, not what is easiest when it comes to their education. And we hope for partnership with them to embrace what parents want and really ultimately what students deserve, which is a quality, consistent, live, synchronous learning experience, Zoom-style classroom province-wide. Now, today I issued a policy directive to all school boards mandating the minimum expectations and standards for educators who are teaching remotely this fall. Parents and students will now have a clear, consistent, and predictable standard to support them in their remote learning for those parents that choose that in Ontario. And make no mistake, we are being bold in this regard. From kindergarten right through grade 12, we're directing up to 225 minutes of the standard 300-minute day for live synchronous instruction, or as I noted, a Zoom-style experience for our kids. Kids in grade 1 to 12 must receive a minimum of 75% of live synchronous learning each day. We would have gone to 100%. However, we do note that unions have raised concern about going outside of the 300-minute day for any one-on-one time, and therefore we preserved 25% of that day for one-on-one support or small group support, which makes sense and which will be needed in our classrooms. To ensure greater accountability, to improve the experience for our students, and for ultimately our parents, we're investing $18 million for staff and administrative supports, really to hire principals, in short, to help administer and ultimately create accountability for parents. Now, within this funding, boards will hire principals and these support staff dedicated exclusively to online learning so that their singular focus will always be on maximizing your child's ability to succeed and creating an element of accountability so you have a point of contact and so that these kids remain safe and supported throughout. For students who may not have a computer or tablet at home, the government has invested $15 million in new funding for school boards to provide technology to those students for tablets or iPads, and in some cases with internet as well. To put this all into perspective, when combined with our previous commitments made over the past few weeks, this means that school boards will be able to access nearly $900 million in targeted one-time funding to prepare them for a safe return to school. $900 million for the unprecedented measures we have taken to combat an unprecedented situation. This is a global pandemic amid an economic recession. We're taking action, one-time, temporary, targeted, timely action to ensure students are safe and that we respond to this generational challenge together. This is in addition to the $700 million we announced about a month or so ago as part of the Grants for Student Needs. It represents the highest ever investment in education in the province's history. Folks, we're pulling out all the stops. We are investing more. We are consistently adding health and safety measures to our layers of prevention. And day in and day out, we are listening to the best medical minds in this province. We're taking monumental steps to protect our children and the classroom that they learn and grow. They absolutely deserve nothing less. With that, I will turn to the Chief Medical Officer of Ontario, Dr. Williams.
Yes, thank you, Minister Lecce, and good afternoon, everyone. I think it's important as we get into this phase of reopening our schools that in our committees and our public health measures team, we have been looking at this for a while. We have been consulting with the Ministry of Education leadership and asking our experts in science and other backgrounds on the research materials coming forward regarding children, regarding transmission in children, and COVID and its impacts upon that, as well as the families. And this has been an important process throughout our staging, as you've been observing. In a sense, what we're going to be asking as for parents engaged in this is because as you go back to school, parents get ready to go back to school. Children get ready to go back to school. And they all do their things. Usually it's around the backpack, getting what's in it, bringing their lunch, all the materials. Sometimes it's new outfits. Some of the boys don't like to wear them, but that's another question. And they get that ready. This year, there's another priority. That's health. And that's a new one. And that's one we were trying to prepare for. And so I'm saying, as well as getting your backpack ready, in a children's area and a school one, and in the community, you need to get your iPack ready as well. That means, what are you going to do to prepare for that? And that means educating your children. What we've been doing all the way along with our staging, we have prepared for this. We have said throughout this time, and I talked earlier today, stage one, we said distancing. We said if you're sick, stay home. We said, if you don't need to go out, don't go out. If you are ill, get tested, get seen. And then hand hygiene. Cough etiquette was still in place at that time. Stage 2, and then on to stage 3. While we opened up more and more of the province, you can go out and do more, gather more in public settings in stage 3, which we're now fully open at this stage. It's still the same messages. You still have the 6-foot distancing. You still have now wear a mask if you're in a public setting where you don't think you can maintain that distancing. You still have hand hygiene. You're still supposed to stay home if you're sick. You're still supposed to get assessed, especially if you think you have COVID symptoms or you've been in contact with a case or you've been exposed. And you're still supposed to do that in a timely fashion. Those did not change during the stages, except addition of masking, and will not change even as we go later into the fall. Now, this aspect is now moved into the school. You've trained your children how to do that in your settings. You have your social circles. You have your cohorts. How does one work with that cohort? How does one deal with that? So in a way, we prepared you to prepare your children to do that. And as the minister said, there's many steps being put in place within the school structures and with the boards and their staff to put those extra layers of public health measures in place. The same things. Distancing, and now you've heard some more announcements about how that's going to be enhanced and improved on. Cohorting, very important. How is that going to be done? Each school, each board, they do what's specific for their areas and working with the local public health department. What do we do with around masking? You've heard what the minister announced and all those things in there that some other areas in the country have not had the same extensive enhancement of resources in that regard. We've talked about our extra staffing going in to assist in the school programs to look at tracing, contact management. We've done that in the province. That's been critical. When people are identified, we quickly rule in, rule out. Do they have COVID or they don't have COVID? All the contacts are traced and notified, and people are advised on what they should do and should not do during that period of time. We're going to do the same in the school environment for the parents and the teachers so they can be advised as soon as possible of what is going on within their community. Why? The community is important. As we work down, and as the minister alluded to, our numbers have been under 100 for the whole province. In the last week, one day we popped over. We nearly got down to 1 under 50, but that was a bit of a data issue. We hope to get that even down lower as the month continues. Our positivity rate's going down. That means our community containment is working. When it's contained in the community and it's not in your community, then it will not get into the schools. So therefore, you need to be paying attention to what's in your community and be advised. And I've been saying all along, in this overall aspect here, we know it's important from the science we've heard is that students need to get back in school. We know that there's no such thing as a totally risk-free setting, but we know that by being advised, taking care of the data and the evidence, you can be as aware as you can be and weigh that risk out because you're assessing that and you need to be kept informed. We need to be kept informed, especially if there's health issues related to you, your child, or your family, so we can deal with that and advise the rest of the people in the school that need to know when they need to know and how they need to know to make a proper response. So we're putting all those things in place, as the Minister Lecce has alluded to, and we feel that we're well prepared to move in, not with the sense of saying we are planning on nothing happening. We want to say if something does happen, if there is a case, we're going to move on quickly, contain it, inform you, educate you, and advise you what you need to do so you're kept advised as to what's happening to your child in the school. You're kept advised as a teacher working in the school and in the community what's happening in your community around the school. So with that, I'm pleased to say that we are approving and working forward with the Ministry of Education on a go-forward basis. As the evidence comes in, as the science comes in, our tables will review that because there's lots of studies happening and we want to know what is good studies and what are not so good studies so we can give any new advice, any new direction, any new recommendations to the minister so they can then advise and change any policies if necessary. So we are as up to date as we can be. We'll continue to be up to date and continue to advise you and recommend accordingly. So with that, I would like to hand things back to Minister Lecce.
Just a reminder, one question, one follow-up. First question.
Your first question comes from Laura Stone with the Globe and Mail. Please go ahead.
Oh, great. Hi, Minister. I must admit, I'm a little confused by your announcement. You're allowing boards to dip into their own reserves. How does that address any of the issues dealing with physical distancing and class size concerns? And can you also address the fact that many have noted that half of the boards don't have reserves?
Thank you for the question. I did see the leader of the Liberal Party suggest that there are 4 boards of the province of Ontario that do not have reserves. So he may have to do his homework a bit more in that respect. But part of our announcement today and part of the communication materials you'll have is for those 4 boards specifically. We're providing $11 million top up to ensure they have 2% to also support operating expenses. To speak to the broader point about what is this $496 million that we're unlocking do. Contingency funds exist for the critical mass, the overwhelming majority of school boards in the province of Ontario. These are rainy day funds in effect for extraordinary expenses and needs. We face a very difficult time, adversity in our economy and our society and in the health of our children. Now is the time to put those tax dollars respectfully to work. I mean, they're literally sitting there. They're cash on hand. They can be utilized. And school boards, some as recently as yesterday, have suggested that and appealed to the province to enable them to use more of their reserve funds. And I think of some in the GTA that have requested that. So this is enabling them to utilize existing dollars that are largely unspent ministry dollars that have been sent to the boards that they haven't utilized to date. It allows them to do really 2 areas of focus. It allows them to support leasing of additional space should that be requested for distancing. It allows them to ensure more social distancing and should they want to hire more educators or more staff. This one-time investment will allow them to respond to the extraordinary health challenge we have. It's $500 million to achieve those very objectives because the consensus position we have heard from medical authorities is while masking is absolutely prudent, distancing is important, and the more distancing we can invest in and support, the better. And that's why we are unlocking this $500 million fund. We're enabling those boards without reserves to have access to those funds, and we're allowing them to have resources for other issues or other needs based on the local community they live.
Follow up?
Thank you. This is a pretty tall order with school set to start in 3.5 weeks. You talk about leasing spaces and logistics that would have to happen for classes size to be addressed. Are you open or considering to delaying the school year or staggering the starts so that school boards and parents have more time to prepare?
Well, I mean, many school boards, to be fair, have already been working on those very plans about looking at alternate community spaces like a community center, for example. They're already in discussions with municipalities, and likewise, they're already in discussions looking at what staff exists to bring online to enable more distancing. So this will not be novel to them. They're already working on this live. What this does is it just enables them to do more of it and to do it quicker with the resources they may require to ensure more distancing, which is something that public health has encouraged us to do. With respect to the aim of the overall objective, I mean, as I say, while we have about a month between now and the return of school, this investment is going to allow them to expand upon the work already being done, and we have confidence they can do that. The fact is we've increased investments. $30 million was announced, to be fair, some weeks ago to provide boards with more monies, more latitude to hire more workers, and ultimately just to ensure more distancing, which is what we want. But that can't be seen in isolation to the other layers of protection we've made. Distancing is, of course, important, as noted by the Chief Medical Officer, but so is having a masking protocol in place that is strong and robust and, comprehensive for all kids between 4 and 12 rather. And likewise, having public health nurses and more cleaning, the fact that we're hiring over 1,300 custodians in Ontario, more hand sanitation products, a testing element that is very robust so that students get access to testing when they need it, including surveillance testing for asymptomatic students. Together, this package is strong. It is nationally leading. If you benchmark it in every area, we are leading in that respect, in investment and in the comprehensive nature of our testing, cleaning, and screening protocols. But I accept that there's always more to do, which is why today we're announcing that we're investing $50 million net new in improving the air quality and airflow in our schools, particularly in those higher risk communities. Likewise, in older schools with older HVAC systems, we just want to make sure we do everything humanly possible to de-risk the circumstance and improve the safety, likewise for the child, but also for our staff.
Next question.
Your next question comes from Chris Rishowi with the Toronto Star. Please go ahead.
Hi there. So you say that you're freeing up reserve funds for school boards to allow them to hire staff and get extra space if they need it. Are you going to mandate smaller classes as well to go along with it? I mean, why are you not just doing that directly instead of sort of just picking around the edges here with extra funding? Why not mandate smaller class sizes?
We're enabling school boards to respond to the challenges on the ground. Some school boards in Ontario will want more spacing, some of them will want more staffing, some will want all of the above. What this does is provide an element of latitude to respond to the risk and to the reality on the ground based on the classroom size and based on their ability to utilize additional space within their schools and within their communities. So we're providing an element of flexibility, but the bottom line is the concern that was cited is that there needs to be more resources in place to ensure more distancing, as well as more resources in place to enable more leasing of additional space if that's required. This investment does that, and it allows school boards in conjunction with their frontline workers and parents most especially to make those investments where they can't and where they're needed. And I think that's important to have an element of flexibility and latitude. But what we have done today is ensure $500 million is invested for further distancing in our schools, in addition to $50 million in improving airflow and air quality. And together that is an additional action on top of the roughly $309 million announced just a few weeks ago that makes Ontario the leading the country in investment on a per pupil basis. And I think it reflects, quite frankly, Chris, our commitment to keep building upon our plan and really keep scaling it up to respond to the challenge.
Follow up?
I'm also hearing from parents of teens in the so-called designated boards. They're quite surprised to find out that their kids will be in class, like in person in class, only about 25 to 30% of the time each week, instead of the 50% that your ministry had promised and had said in memos. And I'm just wondering why the kids in large urban boards are going to be getting so little in-school time compared to students in the non-designated boards.
Yeah, so just so we're clear, the province has made our position known that we expect students to be in class 50% of the time in class and the remainder online, utilizing synchronous live or Zoom-style education for the remainder. I understand some boards have put that out to date. We are working with them offline to ensure that their program reflects the spirit of our direction. We obviously aspire to have children in class for half the time, online half the time, and that online experience will be synchronous, it will be live, it'll provide for a sense of community for the kids and ultimately just a better learning experience when they're not physically in the classroom with their teacher.
Next question.
Your next question comes from Lucas Meyer with News Talk 1010. Please go ahead.
Hi, Minister. Just going back to the timing of this, if this isn't a new expenditure and it's just the one-time allowance to use the reserve funds, why didn't you just do this weeks ago?
Well, the province, in fact, has been increasing expenditure and investment. I mean, before today's announcement, Lucas, we stand as the greatest investor in the restart of any school program in Canada on a per pupil basis, without a doubt. We are spending more in areas like PPE procurement for every student and likewise for every staff member. We're doing hiring nurses, as I noted. We have aggressive testing. We have 1,300 more custodians. We are investing $75 million in more cleaning supplies and staffing as well for that, as well as for busing, an additional $40 million in cleaning. I mean, to be fair, we have put more money in place. We have heard recently, and as recently as yesterday in some cases, where boards have said, look, one way we can help create that distancing that we all want is by unlocking those reserves. There's cash sitting on hand. They're right now, by law, permitted to utilize 1% for operating expenses. We're allowing them to go up to 2%. And in fact, on a business case basis, we'll allow them to exceed that should they have those funds. But the fact is, by enabling them to do the 2%, we're giving them access to $500 million in investment immediately today, which will be, I think, really important for additional hiring, for spacing, and for any of the local priorities that are not linear. I mean, look, in some rural boards, busing may be more of the challenge than it may be in an urban center, for example. You need to have a bit of latitude. We live in a large geographic province. It is a strength, but it also could possess some challenges in different regions of Ontario. And a bit of latitude is an element of strength in this respect. So we're investing today, we're building upon it today, and Lucas, it doesn't preclude us to continue to do that over the coming weeks. I mean, look, this is an unprecedented challenge. We're dealing with an element of adversity that perhaps our province in this generation has not seen. And so we have to be ready to build upon our ideas, to listen to the new evidence as it emerges, to seek the advice and scaling it up and adding those additional layers of prevention. And so we're doing that today. And that's $500 million of your money, that of our hardworking people's money sitting in accounts ready to be invested. And we want to put that to work for something that is of absolute importance, which is to create that distancing and ultimately ensure that the kids remain as safe as humanly possible this September.
Follow up?
Thank you very much. So in terms of the HVAC, it's August 13th. For some of these older schools that have obviously older systems, is this going to be enough time for them to retrofit everything appropriately? And if they don't, does that not mean that you might have to delay the school year? And I think the question is, if a board tells you we can't start on September 8th, are you going to stand with them?
Well, and I know, and I think Chris asked that question as well. Pardon me, I did mean to address it. In the context of a board requesting a staggered start, if, for example, a board wanted to, for the purpose of a safe, cautious reopening, have start, kindergarten on the first day and then adding grade 1 and 2 in the second day, and flexibility. If school boards are saying to me that a bit of a more cautious restart, a staggered restart, having lower numbers of students en masse enter a school, and they'd rather do it through that approach, look, I'm going to support any concept to de-risk the circumstance for kids, and that seems reasonable and not outside the spirit of our plan, which is to get kids back to school at the beginning of September. Now, with respect to the HVAC capacity, in fact, we have been working on procurement with the Ministry of Government Consumer Services and others in public health on two things. One is on procuring MERV 13 level filtration systems that work within our HVAC, within our schools that are more modern. They're the highest standard, and they're excellent level of excellence that I think will ensure the air quality we want. That's for the more modern HVAC systems. But as you rightfully noted, in our government, we inherited a very real challenge in the context of a deferred maintenance backlog. We have a lot of old schools in Ontario. That's why I just announced $500 million to build new schools and renovate existing schools, and I'll be doing that again in the coming weeks. But having said that, for older schools, there's two solutions. One is utilizing an air filtration system that could be brought in to support their HVAC system, or in older schools that may have, for example, portables where there just isn't an airflow capacity, we'll be bringing in standalone sort of mobile units for those rooms. That's what this capital allows. And to be fair, it could be procured on fairly short notice. We already are looking at supply, particularly for the filters, working with the Ministry of Health in this respect. So it can be done, triaging those older schools, those portables, and in those neighborhoods, especially, I think in Toronto, the Northeast, the Northwest, and areas of the province that have higher risk of transmission, those are really going to be the areas of focus, and then working from there out to the more modern filtration systems. So boards can do this. I was in Durham, I guess last week, and I was speaking to one of the gentlemen that works on the HVAC systems. They're currently updating 20 older schools as we speak, not knowing that there's more funding to flow. So boards are already utilizing the $1.4 billion in maintenance funding for this precise reason, to improve the safety of a washroom, or update a water fountain, or in this case improve HVAC systems, which are where they're emphasizing, rightfully so, over the past weeks and months. And now this will just certainly motivate and incentivize them to do even more and go even further to improve air quality in the province. Dr. Linz, would you like to speak on the HVAC systems?
Well, thank you, Minister. And I'm pleased with the announcement, and that the different boards can access and deal with their unique situations. We know that the air quality is an important factor for health, and the recommendations and issues there have been supported by medical experts in there. That only adds an extra method on top of the masking, on top of the distancing, on cohorting, hand hygiene, and the other things that we're putting in place. So this is what the Minister was talking about, and we've talked about from our public health measures table, is these different layers are added on there, so that when you can't do one thing, you can do another one, and so we're adding on further protection, and these kind of investments are most important as we deal with that, with a varied infrastructure across the province, and doing that in a timely way is important, as the Minister's announced, and some are already taking steps in that, and we applaud them for that, and we'll continue to monitor the situation.
Next question.
Thank you.
Your next question comes from Colin DeMello with CTV. Please go ahead.
Hi there, Minister. Your government is setting the parameters here for what the back-to-school plan should look like. Your government has directed school boards, your word, to take certain steps with respect to the school year. The Premier has said that this is your government's plan and that he is responsible for it. Why then, Minister, isn't your government willing to fund what school boards want and fund it in full?
Well, in fact, we are. I mean, what we have done to date is, well, including today's announcement, is invest $900 million in the reopening of schools. And when you benchmark Ontario compared to every province in the Federation, we are leading by virtually every measurement. in PP, in testing, in screening, in custodial hiring, in more investments in cleaning, and likewise in having a clear health protocol that has been informed by not just medical experts in government, but even external counsel and leading pediatric doctors. So in the context of are we responding to the need, I think we have systematically and continuously demonstrated to school boards, but to parents as well, that we will step up our supports to make sure we get this right. And I would not in any way discount $500 million in investment that is being flowing, that can flow right now into school boards' hands for important priorities like increasing physical and social distancing, like additional spaces in a community center, for example, for the purpose of learning. These investments build upon the $309 million a few weeks ago. They build upon the $700 million we announced 5 weeks ago. I mean, it is a demonstration that we will continue to build it up, scale it up, invest more in staffing and in the resources required for school boards. And I think when we are giving them the access to $500 million, I think it's fair to say that we are most definitely responding, demonstrating a willingness that we care deeply about their safety and that we're going to be continuously informed by the science, the medicine, the medical advice that has come to us. And that's why, for example, today, we're stepping it up with an additional $50 million for ventilation, notwithstanding the province already expends on an annual basis every year $1.4 billion for this very type of area of maintenance. So we are doing that, Colin, and we're going to continue to do it. And I think you're going to continue to see us demonstrate to the population, to working parents and moms and dads, and to educators themselves, that whatever it takes, we'll get it right, because we know what's at stake here. And I also think it's important to note that school boards have made many of the requests that we have delivered on in accessing reserves, more support for HVAC, more support for bus cleaning. These are all areas that we have delivered in significant investments, and I think that's important to note.
Follow up?
Today, the Education Union's minister have sent you a letter saying, quote, the Ministry of Education has placed the health and safety of educators, their students, and the entire school community in significant and imminent danger. I'm wondering what you think of that assessment, and are you planning to meet with the leaders of the school, the unions, to discuss what they've raised here?
Yeah, thank you. The Chief Medical Officer of Health of this province, the highest medical authority in Ontario, has endorsed this plan. I just want to reaffirm the importance of that. I respect, of course, the importance, the value and perspectives of our frontline workers, and in this case, the teacher union presidents. Now, we've been working with them and talking to them over 120 odd meetings to date. But the ultimate decision point on safety is made by our medical leaders. It's how, as a province, we have persevered and triumphed in this country as a leader amongst the nations of how to deal and contain this problem and flatten this curve. Because we've abided by the medical science. We have worked closely with our medical leaders, including Dr. William and Dr. Yaffe, and other medical institutes and pediatric doctors that have provided inputs about how we can reduce the risk, particularly in the context of broader community transmission. And we are doing that. Again, for 7 odd days, roughly, we have under 100 cases of COVID. That is amazing, notwithstanding 20,000 plus cases, tests being done in a day. So clearly, the plan is informed by science. It is supported by the Chief Medical Officer of Health. And I think for when it comes to the going forward, I reflect on the really productive and solid relationship the Prime Minister has built with, or the Premier has built with the Prime Minister and the Deputy Prime Minister most notably. This is a constructive relationship. Now, we're progressive conservatives, they're liberals. We're building relationships with New Democrat and Liberal and progressive conservative premiers and ministers of education and finance and health in every province in this country. It doesn't matter your ideology or your conviction. What matters is the safety of our children. And I think when everyone in this country is working together, when everyone is pulling together to do what's right and collaborating in the interests of safety, and the outlier seems to be the teacher unions obstructing and ultimately opposing, it just isn't constructive. And I don't think it's really the time to relitigate the challenges of the past and the debates of the past. We've got to work together, folks. And I think the fact that we are listening, materially standing before you on a weekly basis to announce new investments and new supports, to unlock resources, to follow the science and listen to the Chief Medical Officer of this province should only underscore our commitment to evidence, to science, and to the protection of our most vulnerable, which is our children. And that is our commitment. But we've got to work together. And, when we're asking for example, to change the semestering, to allow for quadmestering, which is a different delivery of classes, because we want to mitigate the amount of contact for their members, for our teachers, with our kids, and that's opposed. When we can't improve synchronous learning, that's the live learning we speak about, that Zoom-style classroom, and that's opposed because teachers were directed not to do it. It isn't helpful. And after half a year, effectively, between summer and the school closure, these kids need to get back to class. It's not an economic imperative. It's for the wellness and the mental health of every child in Ontario. We have a moral duty to them to provide a safe restart with the right mental health supports and a positive space for nutrition, as well as for access to psychologists and psychotherapists and social workers, which is the basis for why we have invested $10 million more in mental health. In fact, $20 million more over the past month, and an additional $15 million for special education for more EAs. We understand this, and we're going to be focused, absolutely focused on getting this right, on skilling it up. But what is required now more than ever is to sort of decouple the division or the issues of the past and work with the government and our health authorities to keep all kids safe, knowing that we are listening to the chief medical, knowing that we have the endorsement of the chief medical officer of health, and knowing that we're going to continue to be there for our students and for our kids and for our educators every step of the way.
This will be the last question.
Your final question comes from Brian Lilly with the Toronto Sun. Please go ahead.
Hello, my question is actually for Dr. Williams, following up on what Colin asked. Dr. Williams, if the unions are saying that this plan puts students and teachers in imminent danger for their health, I'd like to hear from the medical expert. What do you say regarding what this does this plan put the health of students and teachers in any kind of danger?
Thank you. And the what you're asking is that from our experts from around the tables, our public health measures team, our scientific tables, our various medical officers around the province, our data and information, and what Minister Lecce has referred to, as we've continued to flatten the curve and bring it down. As you recall, when we were rapidly increasing in cases back in March, without being asked, I was concerned and recommended that then we keep the schools closed, because I didn't feel with that amount of community transmission that we could ensure the safety in the schools. If there was that concern now, I would not recommend opening at this stage. But I am recommending opening because you can look at our numbers, you look at the data. The thing is, look at the evidence. And if there's concerns and issues, scientifically and evidence-based, we would like to hear those. We would like to have those presented to our tables so we can assess those. All the evidence is coming in. We look at it, we receive it, we compare with our counterparts across the country and internationally to share with the best science and evidence. Right now, if there was a risk, I would not recommend the schools are being opened under the current situation. But what we have is one of our lowering ever of our community transmission rates. We are having all these different methods that our public health measures table has put in place that has moved us from stage 1 to stage 2 to stage 3. And now we're back down to under daily 100 new cases a day in a province of over 14.5 million people. And with that in mind, and with the steps that were put in place at the schools, again, in alignment with our public health measures, the masking, the hand hygiene, the surveillance, the observation, the testing, the case contact management, the idea of having cohorting and distancing, all these things that have been so successful that moved Ontario collectively where we are today. And the public in general can say we are in a much safer place than we were back in early March. We are. It's been an investment. We've done well on it, and we continue to do so. So if there was any risks, I would not be recommending open at this time. But we are concerned there's a risk of not opening and that the students need to be back in those settings for many reasons that our experts and scientists are recommending as well. So therefore, at this time, I don't see those risks. I will be open to hear that. I'll be open to recommendations from all our scientists and our experts and our data to inform us. If there was a risk and I was concerned about it, we would be letting you know and we'd be taking action on it accordingly, any more than there is. There's nothing totally risk-free. But the risk right now in the province of Ontario is, again, as we used to say back in the end of February before we had that influx of infected people, the risk to the general public is getting lower again. But still, we have to be vigilant. We still have to do our due diligence on following all the methods that we said. That's in the community and in the school. And we're going to do that and go forward so we can have a safe school as well as a safe community. So, no, I don't see those risks at the moment, but we'll continue to observe, monitor, assess, and evaluate, and advise if there was any concerns that are of evidence-based and are important to take action on.
Follow-up, this is going to be the last question.
Minister Lecce, you're giving school boards flexibility here to spend where they see fit. So if they want more teachers, they can do that. More cleaning, they can do that. I understand your rationale for doing that, but I'm wondering if you can give me a bit of an explanation as to why you chose this path as opposed to Stephen Del Duca's wanting you to mandate it, and also speak about whether you're getting the type of flexibility that you're offering boards from unions, because I understand there have been basically from OSSTF and ETFO a sense of, if it's in our collective agreement, we're not touching it. We will only allow you to give us more. We're not willing to talk or negotiate on anything that's in the contract.
Yeah. So I mean, with respect to our federation partners, I think what I can just reaffirm to you is that at an extraordinary time in our province and a generational adversity we face, a global pandemic, a recession, an economic recession, everyone's making sacrifices. You know, parents are going to work. They're taking sacrifice. They're taking an element of risk, but they're doing everything they humanly can to not just be good neighbors and good citizens, but to support their families, to stay safe, and to help flatten the curve, as was noted, that we're doing successfully as a province, that we should be collectively proud of our action, noting that we must continue. So when we face this adversity, I think the first instinct of parents and people watching is you got to come together. You've got to put your differences aside. You've got to ensure safety triumphs over the divisions and the issues that, may have the various parties not historically been aligned. I mean, when it comes to health and safety, we should be. And, having questions like, on supervision, the amount of time an educator will be providing supervision, that if it reaches over that minute, right over what is noted in the collective agreement, that they would walk out of the classroom, for example. At least this is what we're being told by the unions. I mean, we need an element of flexibility, folks. I mean, I know many people who just don't benefit from having a cohort of people. They're in the economy. I think of the Walmart worker, to be quite frank. I was at a Walmart opening yesterday. I met a few workers that were there. They have met thousands of people in a day in some cases. I think of frontline workers in the shop floor, or people in office towers and in retail and in tourism. I mean, they're facing a different sense of risk. What I'd say to our unions is we are doing everything we can to limit that risk, to have the benefit of seeing the same group of individuals each and every day, or fundamentally be able to achieve that largely with the same group of students. That cohort is a strength. The PP that we're paying for is an advantage. The fact that we have testing and nursing within your place of work is a strength. And there's so many other things we're doing above and beyond what would be done in any province, or perhaps even in other elements of the public or private sector. So we're doing everything possible as a province. We're stepping it up. People in the economy are going to work. And I think my message to them is we just have to stay focused on safety and not allow the divisions of the past, attempting to relitigate the issues that we actually negotiated over the past year. That should really not be a fault line when it comes to going forward. So I want to work with them, but I need them to work with us. I need them to collaborate in the interest of the health and safety of our students. And when it comes to remote learning, when it comes to giving a bit of flexibility, I mean, as another example, as I mentioned on quad mestering, the premise of quad mestering is changing the delivery so we create more intensified courses. The same number of minutes and hours in that course of instruction. The only thing that really differs is, as opposed to taking a course every week for the whole semester, we sort of do an intensive course up front in the first 6 weeks, for example, 4 weeks. That is a change to what is normally done. We're not asking for any more minutes, not even one more minute more than what they are paid for. We're just asking for an element of flexibility. If that can't be achieved, I mean, my goodness, just the fundamental question is, why not? I mean, if synchronous learning, if the direction from the top, from the teacher union presence, is that they don't want to see that type of learning, and as I read a Toronto Life article yesterday, which was most concerning, that the direction from the educator, the union, was to do the absolute minimum. I mean, we just can't accept that. And as a voice of students and of parents and moms and dads in Ontario, I do expect a quality that is defensible, that is aspirational, that really gives kids every advantage as they deal with some really real challenges, both academically, but be frank, as Dr. Williams noted, even on a more personal side of their wellness, their development, and their mental health. So we just need to make this not about us. If we can stay focused on the task at hand, which is a safe restart in the coming weeks, we can really ensure confidence of our parents and give our kids a safe pathway to September that allows them to learn in a safe space.
Thank you, everyone. That concludes today's press conference.